In the healthcare sector, some of the challenges that we find with the IT providers is management of a shared infrastructure. In many cases, we have one large enterprise infrastructure that services many healthcare institutions, whether they be hospitals, clinics, so on and so forth. And being able to manage that shared infrastructure effectively and meet the SLAs that have been delivered upon to the customers is quite a challenge. Now, the next thing to consider here is within that infrastructure is a lot of critical data. And that's something that needs to be stored and maintained for several years. Being able to do that effectively is quite a hurdle for a lot of healthcare-based providers. And being able to access that data in a way that's secure and quick and effective is a challenge. There's guidelines and best practice out there that can apply to the healthcare industry. But as I've said in the past, guidelines aren't always enough, and solutions need to be utilized effectively to manage these challenges. Now, at NetIQ, in our experience working with healthcare providers, some of the things that we've done is focus on the core infrastructure and work with a top-down focus to push out to the rest of the shared infrastructure all the effective means of management. We're ensuring success of storage of data. We're ensuring that SLAs are met so that people can access that data in a quick enough time. And we're also ensuring core uptime of key healthcare services to make sure that everyone has access to everything they need. At the time being, we find that these kinds of measures take more of a holistic approach, and they're sufficient to the point of management. The next piece that comes into play will be the compliance piece, as healthcare providers are under heavy regulation to meet certain compliance regulations as well. Fortunately, for meeting compliance requirements in the healthcare industry, there are guidelines out there that they must adhere to. In certain regions and geographies around the world, we do see some guidelines that are being pushed down. But, however, there's more that can always be done, and at NetIQ we're always a large proponent of saying don't just follow the guideline, do more than that. And the solution that comes into play will help automate the environment, will help manage the environment, and comply with the environment. We're trying to keep you ahead of your internal auditors and your external auditors who, let's not forget, their number one job is to try and find all of your own issues. To summarize about the healthcare industry, we're talking about, again, a complex environment that has a unique aspect to it because in many cases there's a shared infrastructure that delivers key services to the end user, the core customers. Managing that environment effectively is a challenge at first because there are SLAs that need to be met, there's success factors that need to be achieved, and we have to be able to have pure visibility into everything in the infrastructure to manage it properly. Now, in addition to that visibility, there needs to be compliance. And having solutions that can go through and align the best practice and policies that apply to the healthcare environment to the infrastructure is critical. It's something that NetIQ has a lot of success and history in, and we want to be able to enable the healthcare providers to truly effectively deliver on the services that they commit to.